After 60, your heart sends a specific warning signal during ordinary activities, like climbing stairs or carrying groceries. But 7 out of 10 people dismiss it as just getting older. This isn't aging. It's your cardiovascular system operating closer to capacity, and ignoring this signal puts you months away from a crisis that could end your independence. The mistake that accelerates this process happens every single day in your living room. The silent heart warning your body gives after 60 that most people dismiss as aging. You've probably felt it during what should have been an ordinary moment. Climbing stairs, carrying groceries, or just getting up from a chair. There's a sensation that wasn't there before, something subtle but unmistakable. Most people call it getting older and leave it at that. But that explanation often hides a more important pattern. Your heart may be sending you an early warning signal, and recognizing it could be the difference between prevention and emergency. After 60, your cardiovascular system changes how it communicates with you, and learning this new language matters. The aging heart doesn't just slow down, it adapts, compensates, and often works harder without you realizing it. Think of it like a loyal employee who never complains, but quietly takes on extra work to keep everything running. This is why heart problems after 60 can feel sudden, even when they've been developing slowly. Your heart muscle gradually thickens, your arteries become less flexible, and your blood pressure regulation shifts. These changes mean the early warning signs your heart sends are often different from what younger people experience. What many people dismiss as normal aging, fatigue, or breathlessness can actually be your heart's way of signaling increased workload. The key difference is learning to distinguish between the natural slowing that comes with age and the patterns that suggest your heart needs support. When your heart works harder than it should, it creates subtle changes in how you feel during everyday activities. These sensations often appear weeks or months before any dramatic symptoms develop. If you can learn to recognize these early signals, you gain months or years of time to respond before your heart reaches a crisis point. Most heart attacks don't happen without warning. They happen to people who didn't recognize the warnings their body was sending. Today, you need to start paying attention differently. Not with fear, but with the intelligence your heart deserves. Tomorrow, we'll look at exactly why your cardiovascular system changes its communication style after 60. But first, you need to understand that feeling different during normal activities isn't always just aging. The next pattern we'll explore often shows up during activities that used to feel effortless. Why your heart starts sending different signals after 60, and what changed internally. After 60, your heart doesn't just age, it enters a different phase of adaptation that changes everything about how it communicates. Your heart muscle cells become larger but fewer in number, which means your heart has to work smarter, not just harder. The electrical system that controls your heartbeat also matures, sometimes creating subtle rhythm changes you might notice during quiet moments. Your blood vessels lose some of their elasticity, like a garden hose that's been used for decades and doesn't expand quite as easily. This means your heart has to generate more pressure to move the same amount of blood through your system. Think of your cardiovascular system like a well-established neighborhood where the roads have gotten a bit narrower over time. The traffic still needs to flow, but the delivery truck, your heart, has to work a little harder to make the same deliveries. Your heart responds by adapting its rhythm, its force, and sometimes its recovery time between beats. This is why you might notice your heart taking longer to settle down after climbing stairs or walking uphill. The problem isn't necessarily that something is wrong. It's that your heart is working at a higher baseline than it used to. Your heart's early warning signals after 60 often show up as changes in recovery time rather than pain or dramatic symptoms. You might notice it takes longer to catch your breath, or that you need a moment to rest between activities you used to do continuously. Some people feel their heart beating more noticeably during activities that never used to register. Others notice a different quality to their breathing during exertion, Not necessarily shortness of breath, but a sense that breathing requires more attention. These signals aren't necessarily dangerous, but they're your heart's way of communicating that it's working at capacity more often. The mistake many people make is comparing how they feel now to how they felt at 40 or 50, rather than learning the new normal for their current physiology. Your heart after 60 can be strong and reliable, but it speaks a different language than your younger heart did. Understanding this new language is what allows you to support your heart properly, rather than ignoring signals that could matter. The next thing we need to explore is the specific mechanism that creates these new warning patterns. The cardiovascular mechanism that triggers these early warning signs. The mechanism behind heart warning signs after 60 starts with something called increased cardiac workload, your heart working harder for the same results. Your heart is a muscle, and like any muscle, when it has to work harder consistently, it starts to change structure. The walls of your heart chambers can thicken slightly, which changes how efficiently blood moves in and out during each beat. At the same time, your arteries become less compliant, meaning they don't expand and contract as smoothly with each heartbeat. This creates what doctors call increased afterload. Essentially, your heart is pumping against more resistance. Imagine trying to squeeze honey through a straw instead of water. You have to apply more pressure to get the same flow. Your cardiovascular system does exactly this, which is why your heart rate might increase more during activities that used to feel easy. Your body's response is to increase heart rate, increase force of contraction, or both, to maintain adequate blood flow. This is actually a smart adaptation, but it means your heart is working closer to its capacity during everyday activities. When your heart operates closer to capacity, the margin between comfortable function and strain becomes smaller. This is why the early warning signs often appear as subtle changes in how your heart responds to normal demands. If this resonates with what you've been experiencing, subscribing helps you stay connected to more content like this. Your heart's ability to increase its output when needed, what we call cardiac reserve, naturally decreases with age. This doesn't mean your heart is failing. It means it has less extra capacity to draw from during stressful moments. The warning signals you feel are often your heart operating at 70 or 80% of capacity, instead of the 50% it used to cruise at. This is why activities that never used to register, like walking to the mailbox or carrying laundry upstairs, might now create a noticeable response. Your heart isn't broken. It's working within a narrower range of comfortable function. The key is learning to recognize when your heart is telling you it's working hard, so you can pace activities appropriately. Next, we'll look at the most common mistake people make when they first notice these changes in their heart's response patterns. The first mistake seniors make when they notice unusual heart sensations. The biggest mistake people make when they notice new heart sensations is trying to push through them as if nothing has changed. Many people adopt an all-or-nothing approach, either ignore the sensations completely or become convinced something terrible is happening. Neither response serves your heart well, and both can actually make the warning signs more pronounced. When you ignore your heart's signals and maintain the same pace and intensity you've always used, you force your heart to work in overdrive consistently. This is like driving a car that's telling you it needs oil, but continuing to drive it hard anyway. Eventually, something gives. Your heart is remarkably adaptable, but it adapts better when you work with its signals rather than against them. Many people feel that slowing down or modifying activities means giving up, but actually it means becoming smarter about how you use your energy. The mistake is thinking that acknowledging your heart's signals means accepting limitation, when it actually means preventing limitation. When you pace yourself according to what your heart is telling you, you often maintain more overall activity than when you ignore the signals. Your heart can sustain a slightly elevated workload much better when it gets appropriate recovery time between demands. This is why people who learn to read their heart's signals often have more energy throughout the day, not less. The other common mistake is becoming hyper-vigilant about every heartbeat or sensation, which creates anxiety that actually stresses your heart. Anxiety triggers your sympathetic nervous system, which increases heart rate and blood pressure, exactly what you don't want when your heart is already working harder. Today, try this. During one normal activity, pay attention to how your heart responds without judging it or trying to change it. This week, practice pacing yourself through activities that usually make you notice your heartbeat. Walk a bit, rest briefly, continue. If you have mobility limitations, you can practice this same awareness while sitting or doing arm exercises. Notice if there's a pace where your heart feels steady versus a pace where it feels like it's working hard. If you experience chest pain, severe shortness of breath, or dizziness, these require immediate medical attention, not pacing strategies. Learning to work with your heart's signals rather than against them is one of the kindest things you can do for your cardiovascular system. The next warning sign we need to discuss is one that often appears before people realize their heart is under any stress at all. The subtle chest, arm, or breathing signal that happens weeks before heart problems. There's a sensation that many people experience weeks before any major heart symptoms develop. A subtle change in how their chest, arms, or breathing feels during ordinary activities. This isn't the dramatic chest pain that sends people to the emergency room. It's more like a whisper before the shout. You might notice a slight heaviness in your chest when walking uphill, or your left arm feels tired more quickly when reaching overhead. Some people describe a sensation like their chest is working harder to expand when they breathe during physical activity. These sensations are often your heart's earliest way of communicating that it's operating closer to capacity than it prefers. The tricky part is that these signals can be so subtle that most people dismiss them or attribute them to unrelated causes. You might think the chest heaviness is from sleeping wrong, or that arm fatigue is from gardening too much the day before. Your body is actually quite intelligent about sending graduated warnings, starting subtle and becoming more obvious only if the initial signals are ignored. The early signals often happen during activities that slightly challenge your cardiovascular system. Walking faster than usual, climbing stairs, or carrying something heavier. At rest, you might feel completely normal, which is why these signals are easy to dismiss. But during mild exertion, your heart sends messages through sensations in your chest, your left arm, or changes in your breathing pattern. Some people notice they need to pause during activities they used to complete in one continuous motion. Others feel like they're working harder to breathe during conversations while walking, even though they're not technically short of breath. The breathing changes can be subtle, not breathlessness, but a sense that breathing requires more conscious attention during mild activity. Your left arm might feel heavy or tired more quickly during activities that involve reaching or lifting. These sensations are your cardiovascular system's way of indicating it's working harder to supply oxygen and nutrients to your muscles. The warning signals typically appear first during activities that require your heart rate to increase by 20 to 30 beats per minute above resting. For most people after 60, this means activities like brisk walking, climbing one flight of stairs, or carrying groceries from the car. Pay attention to any new sensations during these moderate activities, especially if they appear consistently in the same situations. Your heart is giving you information about its current capacity and workload, information that becomes more valuable when you learn to interpret it accurately. The next step is understanding what happens in your arteries when these early warning signs are ignored or misunderstood. What happens to your arteries when you ignore these early warning signs? When you ignore your heart's early warning signals, your arteries bear the brunt of the increased cardiovascular workload over time. Your arterial system is designed to handle varying pressures, but sustained higher pressures accelerate changes in the arterial walls. The smooth muscle cells in your arteries start to multiply and thicken, making the arterial walls less flexible and more resistant to blood flow. This creates a feedback loop. Stiffer arteries mean your heart has to work even harder, which creates more pressure, which makes arteries stiffer. Think of your arteries like the leather in a well-used baseball glove that's been stored improperly. Instead of remaining supple, they become rigid. Over months and years, this process can progress from barely noticeable to significantly limiting your cardiovascular capacity. The early warning signs you feel are often your heart's response to this gradually increasing arterial resistance. When your heart consistently works harder to push blood through less compliant arteries, it starts to remodel itself to handle the increased demand. Your heart muscle fibers can thicken, and the chambers can change shape slightly to generate more force with each contraction. This remodeling can maintain adequate blood flow for a while, but it reduces your heart's reserve capacity for times when you need extra circulation. The process happens gradually enough that you might not notice the progressive limitation until you're significantly below your original capacity. Many people first realize something has changed when they can no longer do activities they could do just a year or two earlier. The good news is that arteries retain some ability to improve their flexibility when the pressure load decreases. Regular, moderate exercise helps maintain arterial compliance by creating healthy stress on the arterial walls. When you pace activities according to your heart's signals, you reduce the sustained pressure that accelerates arterial stiffening. Your diet also influences arterial health. Foods rich in nitrates help arteries relax, while excessive sodium can worsen arterial stiffening. The inflammatory process that contributes to arterial changes can be influenced by sleep quality, stress management, and overall activity level. This is why the early warning signals matter. They appear when you still have time to influence the trajectory of these arterial changes. Ignoring the signals doesn't make them go away. It just ensures they'll become louder and more limiting over time. Next, we need to understand exactly how your heart muscle adapts to handle increased workload and what this means for your daily function. How your heart muscle responds to increased workload after 60. Your heart muscle's response to increased workload after 60 is like a worker who gradually takes on more responsibilities without additional support staff. The individual muscle fibers in your heart walls become larger and stronger to generate more force with each contraction. This process, called cardiac hypertrophy, allows your heart to maintain adequate blood flow even when working against increased resistance. Initially, this adaptation works well. Your thicker heart muscle can pump more effectively, and you might not notice any functional changes. But over time, the thickened heart muscle requires more oxygen and nutrients to sustain itself, creating a higher baseline demand on your cardiovascular system. The thicker muscle walls can also become less flexible, which affects how well your heart fills with blood between beats. This is why some people notice changes in how their heart feels during the relaxation phase between heartbeats, not just during the contraction. Your heart might feel like it's working harder even during rest periods, because the muscle tissue itself has higher metabolic demands. The electrical conduction system that coordinates your heartbeat also has to adapt to the changed muscle structure. Sometimes this creates subtle rhythm changes. Your heart might skip occasionally or beat with a slightly different pattern during stress. These rhythm changes aren't necessarily dangerous, but they can be noticeable, especially during quiet moments before sleep or upon waking. Your heart's ability to speed up quickly when needed might also change as the muscle adapts to its new structure. This can show up as taking longer to reach your target heart rate during exercise, or feeling like your heart rate increases more gradually than it used to. The recovery time after your heart rate increases can also extend. It takes longer for your heart rate to return to baseline after activity. Many people first notice this during activities like climbing stairs, where they feel their heart beating noticeably for several minutes after reaching the top. This extended recovery time isn't necessarily problematic, but it's information about how your heart is adapting to its workload. Your heart muscle adaptation is generally protective in the short term, but it works best when supported by appropriate pacing and cardiovascular conditioning. The warning signals you feel during this adaptation phase are your heart's way of communicating its changing needs and capacities. Understanding these muscle-level changes helps explain why heart problems after 60 can develop gradually and then seem to appear suddenly. Next, we'll explore the heart rhythm changes that doctors often don't fully explain during routine checkups, and why they matter. The heart rhythm changes doctors rarely explain during routine checkups. During routine checkups, doctors often mention minor rhythm irregularities or age-related changes, without explaining what these actually mean for your daily life. These rhythm changes can be among the earliest signs that your heart is adapting to increased workload or changing electrical conduction. Your heart's electrical system matures over time, and the pathways that coordinate each heartbeat can develop slight variations in timing or intensity. Many people notice occasional skipped beats, extra beats, or brief moments where their heart rhythm feels off during rest or mild activity. These rhythm changes often become more noticeable during periods of stress, dehydration, or when your electrolyte balance is disrupted. What doctors sometimes don't explain is that your heart rhythm naturally becomes more sensitive to your overall physiological state after 60. If this information is helping you understand your heart better, that subscribe button keeps you connected to more insights like this. Your heart rhythm can be influenced by factors that never used to affect it. Things like meal timing, sleep quality, or even changes in weather. Some people notice their heart rhythm feels different in the morning versus evening, or that certain positions make irregularities more apparent. The rhythm changes often become more noticeable when you're paying attention to your heartbeat, such as when lying quietly in bed. This doesn't mean the changes are caused by anxiety, but anxiety about the changes can make them feel more pronounced. Most age-related rhythm changes are benign adaptations, but they're worth monitoring because they can indicate how hard your heart is working. A heart that's consistently working at higher capacity is more likely to develop rhythm irregularities than a heart operating comfortably within its range. The key is distinguishing between rhythm changes that represent normal adaptation and those that suggest your heart needs additional support. Have you noticed changes in your heart rhythm, especially during quiet moments or after physical activity? Rhythm changes that appear with chest discomfort, dizziness, or significant shortness of breath require medical evaluation promptly. But isolated rhythm irregularities that appear during rest or mild activity are often your heart's way of adjusting to its current workload. Understanding your individual rhythm patterns helps you recognize when changes represent a shift in your heart's baseline function. Next, we'll examine a nutritional factor that can significantly influence how your heart handles workload changes after 60. The mineral deficiency that makes heart warning signals worse after 60. There's a specific mineral deficiency that can amplify every heart warning signal and make your cardiovascular system work harder than it needs to. Magnesium. Magnesium deficiency becomes increasingly common after 60 due to changes in absorption, medication interactions, and dietary patterns that develop over time. Your heart muscle requires adequate magnesium to relax properly between beats, and deficiency makes your heart work harder during both contraction and relaxation phases. When magnesium levels are low, your heart muscle becomes more irritable, which can worsen rhythm irregularities and increase the force required for each heartbeat. Think of magnesium like oil in an engine. Without enough, all the moving parts work harder and wear out faster. Your blood vessels also depend on magnesium to maintain proper tone and flexibility, which directly affects the resistance your heart pumps against. Magnesium deficiency can make your arteries more prone to spasm and less able to dilate appropriately during increased demand. This means your heart has to generate more pressure to maintain the same blood flow, amplifying all the warning signals we've been discussing. Many common medications after 60, including diuretics, proton pump inhibitors, and some antibiotics, can deplete magnesium levels over time. Your kidneys become less efficient at conserving magnesium as you age, so even adequate dietary intake might not maintain optimal levels. The early signs of magnesium deficiency often overlap with heart warning signals: fatigue during exertion, muscle tension, and changes in heart rhythm. Your heart might feel like it's working harder than the situation warrants, especially during activities that involve sustained muscle use. Some people notice increased muscle cramping in their legs or arms, which can be related to the same magnesium deficiency affecting their heart muscle. The connection between magnesium and heart function is so strong that hospitals routinely check and correct magnesium levels in patients with heart rhythm problems. Foods rich in magnesium include dark leafy greens, nuts, seeds, and whole grains, but absorption can be limited by digestive changes that occur with age. If you suspect magnesium deficiency might be contributing to your heart warning signals, discuss testing with your healthcare provider. Magnesium supplementation can be helpful, but the type and dose matter. Some forms are better absorbed than others, and too much can cause digestive upset. The goal is to optimize your magnesium status so your heart muscle can function as efficiently as possible within its current capacity. When magnesium levels are adequate, many people notice that their heart warning signals become less pronounced, and their overall exercise tolerance improves. Next, we'll examine a daily habit that can mask important heart warning signals until it's too late to respond preventively. The daily habit that masks heart warning signals until it's too late. The most dangerous daily habit that masks heart warning signals is gradually reducing your activity level to avoid the sensations you're feeling. This might seem logical. If walking uphill makes your heart work harder, avoid hills. But this approach actually makes the problem worse over time. When you consistently choose the easier option to avoid heart warning signals, your cardiovascular fitness declines faster than it would with normal aging. Your heart loses conditioning, your muscles become less efficient at using oxygen, and your overall capacity shrinks to match your reduced activity level. This creates a downward spiral, where normal activities become increasingly challenging because you've eliminated the mild challenges that maintain fitness. The warning signals don't disappear when you reduce activity. They just appear during progressively easier tasks. Many people don't realize this is happening because the decline is gradual and the accommodation feels reasonable at each step. You might start by taking the elevator instead of stairs, then parking closer to avoid longer walks, then choosing activities that require less sustained effort. Each individual choice seems sensible, but the cumulative effect is a significant reduction in your cardiovascular reserve capacity. When your heart finally sends unavoidable warning signals, they often seem to appear suddenly because you've been avoiding the activities that would have revealed the gradual decline. This is why heart problems can seem to develop overnight in people who have been unconsciously limiting their activity for months or years. The better approach is to work with your heart warning signals rather than avoid them entirely. If climbing stairs makes your heart work hard, climb them slower or pause halfway, but continue climbing them. If walking your usual route creates warning signals, walk it in segments or reduce the pace, but maintain the distance over time. Your heart stays stronger when it's asked to work moderately on a regular basis, even if that work needs to be paced differently than before. The key is distinguishing between dangerous signals that require stopping and normal signals that require pacing. Today, choose one activity you've been avoiding and try doing it at a pace that keeps the warning signals mild but present. This week, practice maintaining activities that challenge your heart gently, rather than eliminating challenges entirely. If you have specific activity restrictions from your doctor, work within those guidelines while maintaining as much appropriate challenge as possible. Monitor how your heart responds to consistent, gentle challenges versus complete avoidance of challenge. If you experience severe symptoms during any activity, stop immediately and seek medical attention. Next, we'll explore what happens in your cardiovascular system during sleep and why this reveals important information about your heart's workload. What your heart does during sleep that reveals cardiovascular risk. During sleep, your heart reveals information about its true baseline workload that can be hidden during your active hours. Your heart rate should naturally slow by 10 to 20 beats per minute during deep sleep, as your cardiovascular system enters its recovery phase. If your heart rate doesn't decrease appropriately during sleep, It suggests your cardiovascular system is working harder at baseline than it should be. Many people first notice heart warning signals during the transition between sleep and waking, when their heart rate is supposed to gradually increase. Your blood pressure should also drop during sleep. This natural dip is called nocturnal dipping, and it's essential for cardiovascular recovery. When your heart is working harder due to arterial stiffening or other factors, this blood pressure dip might not occur normally. Sleep apnea, which becomes more common after 60, forces your heart to work harder throughout the night to maintain oxygen levels. Each time your breathing stops during sleep, your heart rate and blood pressure spike as your body fights to restore normal oxygen levels. This creates sustained stress on your cardiovascular system during what should be your recovery time. Many people with developing heart problems notice changes in their sleep patterns before they notice daytime symptoms. You might wake up feeling like your heart is beating harder than usual, or notice your heart rate feels elevated when you first get up. Some people feel their heart beating more noticeably when lying down to sleep, especially when lying on their left side. This isn't necessarily dangerous, but it can indicate that your heart is working at a higher baseline than it used to. The common fix of just accepting sleep disruption can actually backfire here, because poor sleep quality increases cardiovascular stress during the day. Your heart needs quality sleep to recover from the day's workload, and sleep disruption compounds the stress on your cardiovascular system. If you're taking medications for blood pressure or heart rhythm, their effectiveness can be influenced by your sleep quality and timing. Sleep position can also affect how your heart feels. Some people notice fewer palpitations when sleeping with their head slightly elevated. The key insight is that sleep should be when your heart works least, so changes in how your heart feels during sleep or upon waking are significant information. This next part matters more than the symptom itself: learning to support your heart's recovery during sleep. The simple daily practice that strengthens heart signal recognition. The most effective daily practice for strengthening your heart signal recognition is spending 2 minutes each morning doing a simple heart rate awareness exercise. This isn't about taking your pulse with a device. It's about developing the ability to sense your heart's rhythm and effort level through your body's own feedback. Sit quietly and place one hand on your chest, focusing on the rhythm and force of your heartbeat for about 30 seconds. Then, stand up slowly and notice how your heart rate changes with the position change and the mild effort of standing. Walk in place gently for 30 seconds, paying attention to how your heart responds to this minimal increase in demand. Finally, sit back down and observe how long it takes your heart rate to return to its resting rhythm. This simple sequence teaches you to recognize your heart's normal response patterns and helps you detect changes over time. Your heart rate should increase modestly with standing and walking in place, then return to baseline within a minute or two of sitting down. If you have balance issues, you can modify this by doing arm circles or gentle upper body movements instead of walking in place. The goal is to create a consistent, mild challenge that lets you observe your heart's response and recovery patterns. Over time, you'll develop a clear sense of your heart's normal rhythms and effort levels, which makes abnormal patterns more obvious. Many people discover that their heart warning signals follow predictable patterns once they start paying systematic attention. You might notice your heart responds differently in the morning versus evening, or that certain activities consistently create specific sensations. This awareness helps you pace your daily activities according to what your heart is actually telling you, rather than ignoring all signals or overreacting to normal ones. Practice this awareness exercise consistently for a week, and you'll start to notice subtleties in your heart's communication that you missed before. If you find this type of body awareness helpful, subscribing means you won't miss similar practical techniques. The information you gather from this practice becomes the foundation for making intelligent decisions about activity pacing and when to seek medical input. Your heart's signals become clearer when you give them regular, focused attention in a calm setting. This daily practice also helps you distinguish between heart sensations related to anxiety and those related to physical workload. Next, We'll explore exactly how your cardiovascular system responds when you start working with its signals rather than against them. How your body responds when you start addressing heart warning signals properly. When you start working with your heart warning signals instead of ignoring them, your cardiovascular system begins to function more efficiently within its current capacity. Your heart rate variability often improves, meaning your heart becomes better at adjusting its rhythm to match the demands of different activities. You'll likely notice that your heart rate returns to baseline more quickly after mild exertion when you pace activities according to its signals. This happens because you're no longer forcing your heart to work at maximum capacity during routine activities, giving it room to recover between demands. Your blood pressure regulation can also improve when you reduce the sustained stress on your cardiovascular system through appropriate pacing. Many people find that activities which used to create strong warning signals become more comfortable when approached with a slightly modified pace or technique. This isn't about becoming less active. It's about becoming more efficiently active within your heart's optimal operating range. Your exercise tolerance often increases when you work with your heart's signals because you're training within sustainable parameters rather than pushing past them. The counterintuitive truth is that respecting your heart's warning signals usually allows you to do more total activity, not less. Your energy levels throughout the day can stabilize when your heart isn't working in overdrive during routine tasks. Sleep quality sometimes improves as your cardiovascular system experiences less sustained stress and can achieve better recovery during rest. Your heart rhythm irregularities may become less frequent when your heart operates within a more comfortable workload range most of the time. The anxiety that often accompanies unexplained heart sensations tends to decrease when you understand what your heart is communicating and respond appropriately. This creates a positive feedback loop. Less anxiety means less stress on your cardiovascular system, which can reduce the intensity of warning signals. Your overall sense of cardiovascular confidence can improve as you develop a working partnership with your heart, rather than feeling at odds with it. Many people report feeling more in control of their heart health when they learn to read and respond to its signals intelligently. If you found this approach helpful, a like lets me know this content is worth continuing. The changes don't happen overnight, but most people notice some improvement in how their heart feels during daily activities within a few weeks of implementing this approach. Your heart's reserve capacity may not increase dramatically, but it functions more efficiently within its available range when not constantly pushed to its limits. This efficiency improvement can translate to feeling more capable and less limited by cardiovascular concerns during your daily routine. Next, we need to address the important distinction between heart signals that deserve attention and those that require immediate medical care. The long-term heart health benefit that preserves your independence and mobility. The most significant long-term benefit of learning to work with your heart warning signals is maintaining your independence and mobility for years longer than if you ignored them. Your cardiovascular system is the foundation that supports every other aspect of your physical function: balance, strength, endurance, and cognitive clarity. When your heart operates efficiently within its capacity, it can continue supporting these functions reliably as you age. People who learn to read and respond to heart warning signals often maintain their ability to live independently well into their 80s and beyond. This happens because they avoid the cardiovascular decline that leads to falls, hospitalizations, and loss of confidence in daily activities. Your heart's ability to supply adequate blood flow to your brain, muscles, and organs determines much of your functional capacity as you age. Working with your heart signals helps preserve this supply capacity by preventing the downward spiral of declining fitness and increasing workload. The difference between those who maintain independence and those who don't often comes down to cardiovascular reserve. How much extra capacity your heart has for unexpected demands. Emergency situations, illness, or temporary physical stress require your heart to work harder than baseline, and having reserve capacity makes these challenges manageable. When you consistently push your heart to work at maximum capacity during routine activities, you have little reserve left for times when you really need it. But when you pace activities to keep your heart working efficiently, you maintain reserve capacity that can be called upon when circumstances demand it. This preservation of reserve capacity is what allows you to recover from minor illnesses, adapt to changes in your living situation, and handle unexpected physical challenges. Your mobility depends not just on your muscles and joints, but on your heart's ability to supply them with adequate circulation during movement. People with good cardiovascular reserve can continue walking for transportation, climbing stairs in their homes, and maintaining the physical activities that support independence. The warning signals your heart sends are actually protective. They help you maintain function longer by preventing the cardiovascular exhaustion that leads to rapid decline. This is educational, not medical advice. If symptoms are sudden, severe, or new, talk to a clinician. Learning to work with your heart signals is an investment in maintaining your autonomy and quality of life for the long term. The goal isn't just to avoid heart problems, it's to keep your heart strong enough to support the life you want to live. Next, we'll look at some secondary warning signs that appear in other parts of your body but actually connect to heart health. The secondary warning signs in your legs and hands that connect to heart health. Your legs and hands often show secondary warning signs when your heart is working harder to maintain circulation throughout your body. These signs appear because your cardiovascular system prioritizes blood flow to vital organs, which can create subtle changes in your extremities. Many people notice that their legs feel heavier or more tired during activities that never used to affect them, like walking through a grocery store. This leg fatigue can be an early sign that your heart is working harder to pump blood against increased resistance in your circulatory system. Your feet might feel colder more often, or you might notice that they take longer to warm up when you come in from outside. Some people develop a pattern where their legs feel restless or uncomfortable in the evening, which can be related to changes in circulation. Your hands can also provide information about your cardiovascular function. They might feel cooler, or you might notice changes in their color during temperature changes. The circulation to your hands and fingers can become more sensitive to position changes when your heart is working at higher baseline levels. You might notice that your hands fall asleep more easily when you're sleeping or resting in certain positions. Changes in nail growth or appearance can sometimes reflect alterations in circulation, though these changes develop slowly over months. Some people notice that small cuts or scrapes on their hands or feet seem to heal more slowly than they used to. Your legs might develop a tendency to swell slightly by the end of the day, especially around your ankles when your heart is working harder to maintain circulation. This swelling often goes away overnight when you elevate your legs, but it can be an early sign of increased cardiovascular workload. The key is noticing patterns in how your extremities feel, especially in relation to your overall activity level and the heart warning signals we've discussed. These secondary signs often appear gradually and can be easy to attribute to other causes, but they frequently correlate with changes in cardiovascular function. Today, pay attention to how your legs feel during a normal walk, and notice if there's any correlation with your heart's response to the same activity. This week, observe whether your hands and feet feel different at the end of active days versus sedentary days. If you notice significant swelling, color changes, or pain in your extremities, these warrant medical evaluation, regardless of their connection to heart function. The secondary signs in your extremities can provide additional information about how well your cardiovascular system is meeting the demands you place on it. Understanding these connections helps you develop a more complete picture of your heart health and overall circulation. These subtle changes in your legs and hands often improve when you start working with your heart warning signals more effectively. Next, we'll conclude with why recognizing all these heart warning signs gives you control over your cardiovascular future, rather than leaving you at the mercy of chance. Why recognizing heart warning signals early gives you control over your cardiovascular future. Learning to recognize and respond to your heart's warning signals transforms you from a passive observer of your cardiovascular health to an active participant in its preservation. Most people feel helpless about heart health after 60, as if cardiovascular decline is inevitable and unpredictable, but this simply isn't true. Your heart communicates constantly about its condition, capacity, and needs. The difference is whether you learn to understand this communication. When you can read your heart's signals accurately, you gain months or years of advance notice before problems become serious or irreversible. This advance notice gives you time to make adjustments, seek appropriate medical care, and modify your lifestyle while you still have maximum benefit from these changes. The alternative, waiting until symptoms are undeniable, often means responding to problems that have been developing silently for years. Your cardiovascular system is remarkably responsive to intelligent support, but it responds best when interventions happen early in the process. The warning signals we've discussed are actually gifts from your body, information that allows you to maintain control over your health trajectory. People who learn this language of cardiovascular communication often avoid the dramatic health crises that seem to strike others out of nowhere. Your heart's signals help you pace your activities to maintain function rather than exhaust your cardiovascular reserves prematurely. This pacing preserves your energy and capacity for the activities that matter most to you, rather than spending it all on routine tasks. Understanding your heart's communication also reduces the anxiety and uncertainty that comes from not knowing what your body is telling you. When you know what your heart is saying and how to respond appropriately, you feel more confident about staying active and engaged in life. This confidence itself supports better cardiovascular health, since anxiety and fear create additional stress on your heart. The skills you develop in reading your heart signals often transfer to better awareness of your body's other systems as well. You become someone who works with their body rather than against it, which supports healthy aging across all areas of function. Remember, your heart has been reliably serving you for decades, and it wants to continue serving you well. It just needs you to understand its current language. The warning signals aren't threats. They're information that helps you support your heart so it can continue supporting you. Your cardiovascular future isn't predetermined by your age or your genetics. It's significantly influenced by how well you learn to read and respond to what your heart is telling you. This partnership between you and your cardiovascular system is what allows you to age with strength, independence, and confidence in your body's continued reliability. If this video helped you, the next one might reveal something important about your body. Take a moment to watch it now. You may notice something you've been ignoring.